What I'd like to do is introduce the moderator for our next panel. Omar Siraj is the founder and CEO of Chestnut Health. You'll see in your programs a little bit more about him and his background. And the panel that he's going to be moderating is healthcare as changing landscape in healthcare, which we thought would be a very interesting topic for all of us because we're not only potentially serving in some capacity, many, but we're all part of that landscape as well. So Omar, I'll let you take it from there. Thank you.
Thank you very much, and good morning, ladies and gentlemen. I have someone's wallet here. Ed, care for that? Is that yours?
It's not
okay, I don't want to lose it. It's a wallet. So, we're going to start our healthcare forum today, and I'd like to start by inviting a guest, an auspicious guest, who has tremendously contributed to his community as an entrepreneur, as an alumni of a great school, Notre Dame, and today as a great contributor with great impact by being our platinum sponsor today, Mr. Tracy Graham. Tracy's going to share with us a demo about an app that they're using at AC3. I'll just have Barbara pick it up.
I'm going to talk first. All right. Thank you, guys. I think the first thing I'll say is today Notre Dame is playing USC, and later tonight, and I'm going to get back to South Bend so I can see that game. I did play football for Notre Dame as well, almost 20 years ago, before I was an entrepreneur. So I guess I'll say as well, I'm honored to be able to talk to you and share a little bit about AC3, or Advanced Centers for Cancer Care. I want to thank Open Chicago and Omer for allowing us to talk and be a platinum sponsor here. I'm the CEO of a company, Graham Allen Partners, but across our portfolio companies, we have approximately 300 or 400 data scientists, oncologists, radiologists, software programmers, and many other clinical and technology teammates who basically wake up every morning and focus on helping patients. Now, what many of you are probably thinking is software programmers and machine learning guys, data scientists, how do they do that? And so while what we do is really important, I can't tell you how much the last speaker had it dead on. Why you do what you do is even more important. Our people fundamentally believe that the healthcare system is broken, and that data and machine learning and artificial intelligence can help to fix it. So every morning they get up focused on trying to solve that problem. You'll hear a lot about that here. Here we have some machine learning experts in the crowd. I just say there's 5 basic things that we start with about healthcare for us. The first is the cost of the healthcare system is unfairly biased against commercial payers. And when we say commercial payers, we mean businesses, employees, people who pay sometimes 2 or 3 times the cost of Medicare and Medicaid. So we fundamentally believe that's unfair. 2, we also think that to fix this system, I think we have to acknowledge that someone has to give up something. In our language internally, we talk about somebody's going to lose. Who's it going to be? Is it going to be the drug manufacturer, the hospital who has premium payments, the providers or independent physician groups, the brokers, the TPAs, the carriers like Anthem, the drug distributors, the medical device guys? Someone is going to have to give up something because the pie is going to stop growing at the rate that it's growing. So if you accept that, then you sort of see the problem here that we're trying to solve. We also believe, number 3, that the winners will reduce costs and get paid more. Now the question is, how on earth do you do that? How do you reduce costs but also make more money, more profit? I think the answer to that is pretty clear. You got to cut somebody out of the pie. Somebody's going to lose. You got to take more from someone. Fourth, we believe that the winners will demonstrate an ability to move market share. So much of what you see from us is about how do we move market share of patients, market share of drugs. That's a big part. Market share of medical devices. Someone's going to have to be able to move market share to lower cost providers. And then finally, and I would argue most fundamentally for us, big data and analytics, machine learning, artificial intelligence is going to play a key role in doing it. The transparency to doctors is going to be very, very important. I'd like to take a second here, and I think we're set up to show you a very brief demo of what we do, some of the things that AC3 is working on. We believe the ability to move market share is a game changer in the healthcare system. And when you can move market share at scale, your customer base expands well beyond healthcare providers. Of course, there are physician groups and other hospitals and all of those guys, but we also see opportunity to sell to large drug companies. I think that's a big part of what we do. Investment banks are also big customers as well who are interested in our information. And for me, what's so compelling about what we've developed is that it translates into other key behaviors of companies. It helps providers understand how to manage the referral patterns. I think we have some physicians in here, I read as well. Referral patterns are important. It helps employers change employee behavior and so on. So to that end, I want to do a quick demonstration so that we can move on very quickly. If you hear, if my wife calls while we're here, just forgive me. All right. So quick demonstration. As I said, we're a sort of early stage investment company, and we invested in AC3 in partnership with my partner, Dr. Ansari. And what you have here is an app that we have developed. There's tons of machine learning going on behind the scenes for this application. Literally, we are processing daily and in almost real time. A lot of it is batch, but some of it is real time. Billions of rows of data a day, hundreds of millions of transactions every day that go on inside clinics and hospitals all over the country. This is a beta version, and it has sample data from one of our customers. So an example would be, we think it's important that a doctor ultimately is going to have the ability to have information in their hands at the time where they can do something about it. And so I'm going to focus on drugs only. So there's a host of different solutions we have here, but the first one I'm going to click on is what we call Pharma Insights. And what this cannot be done in many cases today because people don't have the data machine learning background and all of that in there. So what you see is the cost and margin of drugs. So what's the problem? Today, physicians in oncology produce give drugs without any knowledge of what the financial outcome of that decision is. In many cases, I say, they cure cancer and cause a heart attack because they bankrupt the person that they're curing cancer for. They have no idea of that. So we basically can look at every drug, and the physician will know at the top what you see is the margin. At the bottom, what you see is the cost. One of the most popular drugs in America is a drug called Neulasta. I'll click on that one. It then breaks it down and tells you what the profit margin is, cost per package, year-to-date spend, $7 million. This represents about 7 physicians. 7. Now imagine what that number is over 1,000 or 10,000. There's 11,000 oncologists in America today. We're talking billions of dollars. We break it down by class. This is all the physician is seeing this in his hands his or her hands every day. This information is now available where it hasn't been in most practices. In this case, it gives them all the different drug choices, and then also by margin, what the margin is on each drug and financial outcome for it. I'll move on quickly. And then we have the platform where we send insights, very much like you get a notice that somebody just posted on Twitter. So behind the scenes, we're negotiating billions of dollars in contracts, and we are able to send notices on this platform to physicians all over the world that basically says to drug companies, we have this example says, Keytruda has a 3.5% margin increase. Now, 3.5% of $1 billion is a lot of money. And we're able to move the market on a drug literally in seconds. In seconds, we can send a message and negotiate contracts, and we have with McKesson and Cardinal and some of the other guys. Now, I'm going to wrap up because I know I only had 10 minutes and we got to get the panel going, but I just wanted to show you an example of how machine learning and data and putting information in the hands of physicians are going to fundamentally change how medicine is practiced in the future. Thank you. Okay, thank you.
Tracy, thank you very much. I think it was very insightful. I think Tracy could go on this for hours, but it is very shocking, and I think there's a lot to be said about having information, having relevant information, and making educated decisions at all times. I'm going to go ahead and launch our panel formally to request each of our panelists to quickly say hello.
Assalamu alaikum. I'm Khan Siddiqui. I'm the co-founder and currently the CTO and the chief medical officer of a company called Higi. I'm a physician by training and engineer by profession. So it's a long story if I go around how I got to there. I think we're going to talk about that later, so I'll pass on.
Sure. My name is Sapan Shah. I'm a physician and attorney. I started a company called Flagship Healthcare. Also, I'm a candidate for U.S. Congress in the Illinois 10th Congressional District. I've known Amer for several years because of work and other things, and happy to be here.
Can you hear?
Who's controlling this?
I'm a medical oncologist, and me and Tracy both decided to be part of the solution of the healthcare rather than be the problem.
Yes, and our platinum sponsor. Thank you, Dr. Bilal. And everybody knows Tracy. So I'm being reminded by our president that we are pressed on time. So I wanted to take a few minutes. Is it working? I wanted to take a few minutes to quickly set the stage about the discussion on healthcare. We can go on for days discussing healthcare and all the problems with it and all the politics of it and all the discussions and all the satisfactions and dissatisfactions. Today, in the next 30 minutes, I want to spend a few minutes to set the stage of how we're going to look at healthcare today. The goal being that after you guys leave today, hopefully you leave with a perspective, a better perspective than what you walked in with. When we talk about the changing landscape of healthcare, the first question that comes to mind is that why a change? Why is there a need for change? And I'll draw from Jay Sakhawat's comments earlier that what is the problem? So I'm going to touch a little bit about the problem and what is it that we're trying to solve and how are we solving it. And then in the end, I'll let you guys be the judge of it, if the problem is getting solved or not. And there's going to be a dialogue between you guys and the panel to judge whether what's being done is good or not. So the problem with healthcare is only twofold. There are only 2 points that I want you to keep in mind about the problem. Number one, that the cost is going up. The cost is going up. It's surging perpetually, year after year, at a higher rate than what we can sustain. The national health expenditure number would show you that the healthcare cost is going up at over 5% year after year. for X number of years. And I don't want to go into the details of the statistics, but we're looking at an over $3 trillion industry. That's the health expenditure, national health expenditure. You can Google it. Everybody can check it out. That's the sort of monies that goes into healthcare. That makes up for over 18% of the GDP. And it's growing, so it's a big portion of the economy, and it's growing at a faster pace than the pace of growth of the economy or the inflation rate. So if nothing is done about it, it's bound to collapse. So that's the first reason why something's being done about it. The second biggest reason is the outcomes. What is it that we're paying for? The idea of healthcare is to be healthy. It's self-explanatory. Are we healthier? Is our population healthier? Is everyone getting the coverage? Are the outcomes of the healthcare interventions getting the outcomes that it should? And are we getting healthier as we're spending more money? The debate is that the outcomes are not being measured properly. And with the child obesity, with the increasing rate of incidence of cancer, heart disease, and so on and so forth, we're not convinced if the population is healthier. So that is at the backdrop of the healthcare discussion. Then comes the Affordable Care Act, where the government intervened in 2011 in an attempt to again target only and only these two variables. At least that was the idea, to reduce the cost and improve the outcomes. And in that spirit, it opened up the doors for a large play of private sector to come in and innovate with the entrepreneurial spirit, with the innovative spirit, with the technological spirit, and come out and see how they could tackle these two problems, lower the cost and improve the outcomes. So today's discussion with our panelists is essentially, you have a group of individuals in front of you where each of these individuals are exemplary in their niche, in their specialty, and they have truly successfully targeted one or the other, or both of the problems, and shown results. And I would request them now kindly to start with Mr. Khan Mohammed to give us a brief story of what is his story. How did he tackle the problem? And what did he do about it? And what is he doing about it? And what's his perspective? And we'll go one by one. So we'll hear 3 or 4 key stories. And then I would like to know your perspective. How do you think the healthcare has turned out? Because it's at the end of the day, it's all about you. We're trying to make the population healthy. So I'd like to know your perspective with your questions from the panel and me. Thank you. Khan?
Sure, thanks, Amir. That's a difficult one to go start with. So let me give you a little bit of background how we got started or what we did. So, before starting Higi, I was at Microsoft running engineering teams in their health solutions group. And one of the problems we immediately identified was, if you go back and look at what impacts outcome of a patient's health, and look at all the research done since the 60s, it talks about social determinants of health, right? So it's things that happen outside of healthcare, right? So genetics contributes to 15% of your outcomes. Practice of medicine, what as physicians we practice, contributes to another 15% of outcomes. But then 60 to 70% of outcomes is what is happening outside in the environment, in the social circle that you live by. But as physicians, we don't see what is happening there, right? So we see data that comes in during care episodes, but we have no idea what is happening between care episodes till the patient comes and tells us. So that really, how do we go solve that problem is where I started with, trying to figure out how do I bring this awareness, knowledge of the social determinants that if impacting 70% of the outcomes that we actually do, even though we are judged and with quality-based care, we are the ones who are taking the financial risk, or the plans taking the financial risk on it, but it's what is happening in your community, what are you doing between care episodes, that's what is actually contributing to those outcomes. So as thinking about this stuff, we first realized that we need to be where the patients are, right, or the people are, rather than wait for them to come to us. And then bring this data into the right providers or health plan or payer who actually can take action on that data in real time. So we started with building a network of kiosks. It's a self-service screening stations that we put in retail pharmacies, grocery stores, community centers, in corporate offices around the country. And then where patients normally go and interact with it. And then we provide software solutions to help anybody taking risk on a population. Could be a health plan, managed care organization, a health system that is both a payer and a provider, or a self-insured employer, where we help them to reach the population that they're trying to manage and take risk on, know more about those populations through those solutions, and then be able to manage those that are high cost as part of that ability. So we do about 1.3 million screenings a week for those patients. We have over 45 million patients on the platform that are currently managing. So, and some of the large health systems and health plans who are taking risk on populations are our customers around the world. So that's how we are helping reduce costs. The patient doesn't have to come to a doctor or go do everything. And a lot of these basic tests, as well as interaction and awareness, can be happening in the field, in the community where they already are.
So essentially, what you're saying is that Khan Mohammed's company, and please correct me at this if I'm wrong, but it has improved the access to care. So more people can access healthcare more readily through the kiosk and the technological innovations, so that their problems are addressed early on before they become more complicated, and the health outcomes go down and the cost goes up.
That's absolutely right.
Correct. Sapan, please.
So our business is, I think, well suited to independent physician practices. We represent independent physician practices, and it goes to kind of my view that there's two fundamental problems in healthcare. And the only thing that matches the size of healthcare's impact on our economy is sort of how convoluted the discourse is about healthcare. Everybody sort of has ideas about fixing it or how bad it is, but those two things never seem to come together. But I think there's two fundamental problems from my perspective. One is that there's probably no other market, certainly not one this large, where the costs of a particular service, who's paying for that service, and who's consuming and selling that service are all unaligned. You know, when we go to a restaurant, we know what the price of our dinner is. We choose to purchase it or we don't. Healthcare is an enormous, enormous expenditure, and we don't have any clarity on what we're buying. We don't have any clarity on how much our subsequent costs will be. So that's one big, big problem in healthcare. The second big problem in healthcare, I think, and I'm definitely pro-doctor, and I should sort of disclose that, is that I think most of the growth in healthcare expenditures and most of the growth in terms of the way services are being provided today are related to size. They're not related to efficiency or value. And so if we look in Chicagoland or we look across the country, we see mega groups of physicians and mega groups of hospitals forming, and they exert their size and their influence to generate better returns, better payment contracts, other things. But I don't think they can say that they've been more efficient in delivering care than other physician units. Our group represents about 1,000 physicians in private practice. And private practice isn't the end-all, be-all of every healthcare solution, but certainly small group practices where physicians are directly interacting with patients indicates one of the most efficient healthcare delivery structures that we have. Also, they tend to be very good and vested small businesses in all of the communities that they're in, whether in this state or across the country. So certainly politically, I'm pro-competition, I'm pro-doctor, but under those two big headings, this is where our business fits on one side of it.
Thank you. Thank you. Bilal?
So my journey is a little bit different. I came from a very small town, Matiari, Sindh. When I came here, I had education. My parents were physicians. I went to a very small college, Muncie, Indiana, 20,000 people. I was content. I was told, this is probably what you're going to do. And then I took a wrong turn in life where literally I told Umair I was going for a fellowship interview. I missed it. I called my wife and I said, I missed it. I'm very content. Let's just stay here.
You missed the exit.
I missed the exit. And she said, I think you should still try. And I looked and I saw the airport. And then I got on the plane. I became an oncologist. And then I realized that these bills don't make any sense. And I called my father, and he is an orthopedic surgeon. And I said, how can a care in Pakistan be of this price and in America be this price when the outcomes are the same? Tracy, a great friend of mine, kids went to school together. And we said, let's just put a sense. Let's try to solve this problem. This is about 8, 9 years ago. And we started this company, we started the data. And he said, you cannot achieve anything unless you have the right data. You can talk about it. So we got data from Pakistan, we got data from here, and we analyzed, and we realized that the problem was much bigger. A $3 trillion problem was way bigger what we could have imagined. We could only make a small dent, and that's what we decided to do. And we hope that this new generation, I saw a lot of kids sitting here, they can take to the next level after us. We hope to give the platform to them, and I think this problem can be solved. It's very simple. There are too many in-between people. Physicians do the work, and Tracy is the one who told me physicians forgot one thing. The power was in their pen. We thought that the power was with insurance company, with hospitals and everything. We proved it. The minute our program we don't call it tweet, we call it whisper. The market changed by $1 billion. And that's when we realized that the power was in your pen, and we could make the system go right again.
Absolutely. Thank you, Bilal. So in this limited time, I just wanted you all to capture a little bit about what our panelists have done. I'd like to open the floor to questions. I encourage you to ask us a lot of questions on what your experience has been with healthcare. What do you think? Do you think that the service that you get today is better? Do you think it's at a lower cost? And more importantly, how do you see entrepreneurship playing out in this? What are the entrepreneurial lessons you want to learn from the journeys that these gentlemen have had? Any questions?
Hi, right here.
Yes. Hi.
Yeah, Raheel again. About a couple months ago, I visited Mercy Hospital in St. Louis, and I realized they just had invested about $250 million to create a virtual care center focused around this idea of patient engagement, meaning the doctors, and it's about a 12-story building and it's just full of doctors and nurses, but no patients. They all are managed and seen virtually. And partly the goal was to actually, really get to know the patients and work with them as an individual, as a person, and provide effective healthcare. But that was an investment they had to make, right? Decide that I'm going to invest $250 million to get this up and running. How do you see that idea of virtual care, the investments here, and the desire to actually get closer to patients to change some of the dynamics that you're talking about here?
Who's the question for?
Maybe for Sapan, perhaps.
Sapan.
We see a lot of, I'm also a member of Hyde Park Angels upstairs, and we see a lot of opportunities in the telehealth space. Specifically, one of our portfolio companies was a group called Regroup Therapy. We led the deal on them a couple years ago, and they just got an up round. We're very optimistic about that space, in particular for a specialty like psychiatry, where we sort of joke that they never do a physical exam. So they're well suited for telehealth, and that group is doing very well. That's an indication that model is gonna develop and grow. And I think that's a subtext to our whole discussion, is that, this is a group about Pakistani entrepreneurs. When a system is this messed up, and there's so many opportunities, and so it should be really a thing to look out for as a young entrepreneur, that there can be small fixes, big fixes, but there's a lot of opportunity.
Any other questions? Yes.
My question is with Mr. Mohammad Khan.
Sorry.
Mr. Mohammad Khan, please let us know that how you connect the end users and providers, and what is the benefit to the community. Thank you.
Sure, absolutely. So if you think about it, our focus really was, how do we make a habit of people connecting with healthcare all the time, right? So the reason we chose to put our stations in retail pharmacies and grocery stores, because you have to eat. You have to go buy your food on a weekly basis, or maybe more. Typical adult goes to a grocery store about 1.3 times a week. So how do we make a habit that when you're doing there becomes a health moment? And when you're doing that, how do we get the data in real time back to your physician who's actually managing your population if you're part of that program. So that's what we do. When somebody walks in, so about 55% of Higi users, when they walk into a grocery store, so they go use our station first before they do any shopping. So that gives us opportunity to influence their buying behavior. So don't buy that heavy cream ice cream, maybe not those potato chips, do something else kind of things. But also if you're hypertensive, idea of how do you identify low salt elements in the store. So we're kind of providing that communication to it, but in real time, if they're connected and sharing the data with their doctor, data goes back into their population health systems for the health system or the physician who's taking care of it, or the health plan or the payer who's taking care of it. So that's how we're trying to do it. I mean, if you think of it, if you're trying to do 1.3 million patient visits a week, what's the cost? So the lowest possible cost, if you think of it, is $37 per visit. If you're trying to do a nurse practitioner or even a lower provider to do that cost, multiply that to 1.3 millions is what's going to cost you to bring all these people in front of a physician. We are providing that experience through a virtual means on an automated manner and getting data back into it, and virtually getting message from that provider, physician, or health plan to the patient in real time on a weekly basis. So it creates that continuous engagement opportunity with the patient. I hope that answered your question.
Thank you. Next question.
My name is Fawad Khan. I'm a retail pharmacist. My question is for Dr. Ansari. So basically, as you mentioned that, the power is basically in a prescriber's pen. So I need further explanation on how we can bring down the cost of, we are talking about like $3 trillion cost for healthcare that we are paying. And I always get patients yelling at us, that, how come my copay is so high, I cannot afford this medication. I will just give you an example, like hepatitis C medication, Harvoni. A 90-day, prescription cost is almost $100,000. So when you say that, it's the prescriber's, power, the pen power that, that you guys have. So how we can, implement this, and how, it can bring the overall healthcare cost down.
Thank you.
You're welcome.
So the way I have seen it, envision, your platform has to be big enough to make the difference. And I'll give you an example. If you have two drugs and both have same efficacy, then what this platform does is you have Bristol Myers sit on the left, and you have Merck sit on the left or right-hand side, and you say you need to bring the cost down. And one has to agree, or one who has a dominant power, you send the whisper against the other one, and we shift the market. So that's how we are able to bring the cost down. So it's a very simple maths. If you make the most, you got to give it something back to solve the problem. And we all know that the R&D is taken out in about 3 months. So after 3 months, 99% is the drug company's profit. They have lot to give back. That's what.
Thank you. Thank you very much. Yes, sir.
Assalamu alaikum, Bilal Ashraf Lakhani from Naperville. We go back 25 years ago in Muncie.
When I had no place in Muncie, I came to you.
Thank you. But anyway, hopefully you can answer my question along with Tracy, who mentioned that you guys really squeeze margins, at the cost of trying to get affordable costs. So a lot of my employees, every time they really talk to me on our annual meetings, hey, what can you do to make it better for the healthcare cost? So far, I have not been successful in trying to really find a good insurance company that can take care of the employees, at the same time enhance the ownership and patients and cure them. Yesterday, I don't know if you heard about Gilead Science came out with a phenomenal drug for cancer. Over $350,000 for one dose. How can someone really, without having a heart attack or to bankruptcy, can afford that? So if you can really throw some light on that, I appreciate that.
Thank you for your question. After this, our next question will be the last question. Sorry, we have to keep it short. Go ahead.
I think the basic answer is under the current system, you cannot. That's the basic answer. The future answer is that the drug companies, their businesses first. They will only respond. And I see this because this idea that one of the first panelists talked about, this sense that there's a problem that is bothering you as an entrepreneur, this problem fundamentally bothered me. because I was behind the scenes doing the negotiations with the drug companies when they said, you want me to have a higher price. And I said, why would I want you to have a higher price? They said, because you represent providers, and the providers get 6%, let's say, for Medicare or for drug companies. So 6% of $350,000 is a lot more than 6% for a much smaller number. So as long as the incentive for all of the providers, all of the drug manufacturers, is to increase the price, and the people who have the pen have more incentive because they get 6% of a bigger number, that's a bigger number, right? So there is no, in this system, there's no way to do it. So what do we have to do? We have to say to one manufacturer over the other, if you keep your price at $350,000 and the efficacy of the drug is the same, we're gonna move $1 billion to the other person, unless you drop your price. And we have seen that happen in real time, where we are able to say, with the push of a button, to 1,000 physicians or a large number of physicians, move to this direction if the efficacy is the same. That's the only answer, is driving it down. They're business people first, not physicians. They're business people.
Thank you. Thank you very much, Tracy. Any other questions? We have last one. Kiran, go ahead.
What about the price of simple antibiotics? These are pretty old, so I often wonder why simple antibiotics cost $30 in the US, while they might be $4 in India, so the same qualities. So can these patents run out someday?
So the question is, why are antibiotics that have been in the market for so long still overpriced compared to other countries?
You have to co-factor some expenses of where we live. But at the same time, the answer is still the same. Biosimilars, whatever you call them, these are the new drugs that are coming out which has a similar efficacy. You've got to have 2 or 3 or 5 people in the room who do provide you the same product and say, who's going to give me the best price? And that's the only solution we see in the current market.
Thank you, Bilal. On that note, before we wrap up, I have one question for the panelists, for each one of you. And I think this would be important because healthcare is so complex. We had so much of healthcare to talk about that we didn't get to touch on your journeys as entrepreneurs. What is the single biggest mistake that you have made in your journey that you either regret or seriously learned from? Khan?
Biggest mistake. So there's so many mistakes. I'm trying to figure out which one is the biggest one. So I think I'll answer in a way that what Jay also said.
Briefly, we don't need to know everything.
No, focus on the problem, right? So you cannot lose focus on what the problem you're trying to solve, right? So if there are a lot of shining objects get thrown at you. Hey, here's $1 million deal, go do this. But if it's not solving the problem you're trying to focus on, it's going to distract you from that stuff. So we have derailed sometimes in that space. In the beginning, it took us longer to get back. Now we've learned the lesson. We try to move faster in this direction, but there's a lot of mistakes we made.
Sapan?
I would say that working on too many things at the same time. Early on in our business, we had 2 ideas concurrently going, and so we kind of felt like we could run 2 ships at the same time, and we realized that we couldn't. And so we ended up closing one of them and really focusing on one, and luckily my wife was patient with the whole process. So. Thank you.
I would say trying to do things that you don't know, that has resulted in some of my failures, and underestimating things that you knew, and getting overwhelmed from the environment that you cannot do. Don't give up. So if you believe that you are on the right track and everybody else doesn't believe in you, still keep moving on.
Thank you. Tracy?
Very quickly. I think I've been an entrepreneur now for 20 years since my graduation. I've built and sold 3 or 4 companies, and I've learned a lot, and I've had a couple of failures. The lesson is focus. Know what you're good at and focus on that. Get as much scale as you can get on the things that you're really, really good at, and not dilute yourself, your time and effort and energy. That's been the biggest problem that I've seen.
Gentlemen, that has been just wonderful. Thank you very much. Thank you. Give a round of applause.